to have Angela part of our team and better to assist us and kind of co-work with us and make everyone better, right? So this is Angela. She's going to be running today, and Roger and I will be assisting. And go.
All right. Hi guys, my name's Angela Scamardella. I'm a physical therapist here in the area. A little bit about myself. I grew up here in St. Pete, so I'm super excited to be back home. I went to UCF for my 4 years of undergrad, got my bachelor's in health sciences there, and then got to live in St. Augustine at the University of St. Augustine. I was there for 3 years, and that's where I got my doctorate. So now I'm back here at home base, and I'm really excited to meet all of you guys and be working with y'all. So my passion really as a PT is trying to teach people how to break down certain movements and just start to understand maybe where certain deficits are coming from, why we have back pain, why we feel like some movements just aren't in the range that we want them to be in. So that's going to be my job kind of here in unison with the trainers that have so much experience about mechanics and how the body already moves. I just want to add my experience about anatomy, the biomechanics of what we learn in school, different hands-on maneuvers that I can do as well that I learned, and just kind of tie that all in together, just to get an understanding on that. And then Heather and Roger are clients of mine that I've been working with a little bit now, so it's been really good talking to them, kind of seeing how they work, and we just have a good idea on how we can collab as a group, okay? So this is our presentation, back in control. So who here has discomfort in their back when they do RDLs, squats, any movements like that? Or lifting their kids, lifting their grandkids, groceries? Everyone. Okay, that's why we're here today. All right. So our workshop is called Back in Control. So we'll go ahead and get started. And I'll leave some time for questions at the end. So if you want to jot anything down, you guys are welcome to, okay? So our objectives today, first thing, most importantly, is talking about the anatomy and structure. Then we're going to talk about my physical therapy assessment, how I go step to step. This is going to be more general because I don't know everyone's situations individually, but obviously down the line, if this is something that you could consider being very helpful for you, then we chat one-on-one and we can kind of get more into the nitty-gritty of what's really bothering you specifically, okay? And then we'll go into mobility training and then muscle activation, so our core work, deep, strengthening those deep muscles in our low back, things like that. And then a spine protocol at the end that you guys can take home with you, and it's something that you can implement already into your routine, okay? All right, so first thing, understanding the low back. So when we talk about the spine, we're really talking about the foundation of our whole entire body. Our shoulders won't work well if our thoracic spine isn't moving great. Our legs aren't going to work well if our lumbar spine isn't moving great, right? So it's really important to understand the direction of that. Now we're going to go ahead and also I want you to understand that your spine isn't just a stack of bones, right? It's a dynamic structure that needs to control mobility and stability. So we're really going to educate you guys about that today. And then also this workshop is going to inform you on the different ways to enforce normal, healthy movement in our day-to-day lives. And then we'll also discuss some common causes of pain and discomfort, whether it is a disc herniation that we might have been told that we have, disc degeneration, things like that, that can become age-related problems, but we're just gonna understand what it means and how we can control it so it doesn't get any worse, okay? All right, so understanding stability and mobility. So spinal mobility. This is gonna refer to our spine's ability to move freely and efficiently through its full range of motion. And why does this matter? If your spine is too stiff, your body will try to compensate in other areas. So for example, if you try to do an RDL, your spine is too stiff and you feel it in your low back, now we're starting to compensate in our hips, in our glutes, and in other areas that our back is not really ready to accept that kind of load. And the reason that is going to be very important is that we want a spine that moves where it should be, and we want a spine to be stable as well where it needs to be. So then when we're talking about spinal stability, the ability to maintain control and support of the spine during movements or load. I gave the examples of RDL and squats because that's a lot of the compound movements that you guys are doing here. And your lunges, hinging movements, all those important things that you guys get taught here in the gym. So why does this matter? Training the muscles that keep your spine aligned is going to help to avoid any excess strain in areas that we don't want to. For example, that bending and twisting motion that we do when we get something out of the car, a lot of times someone feels like, oh, my back just went right there, right? If we work on those core muscles, if we work on those deep lumbar stabilizers, which I'll go ahead and talk about, that can help prevent any of those injuries. And this is the anatomy and structure. So to give you guys an idea, on the left here, those two that are coming out in a diagonal like that, that's your QL. The one in the middle is our multifidus, and the one on the right is our transverse abdominis. So the reason that these are important is these are the 3 specific muscles that are going to help with stability. That's your natural brace that your body can have. A lot of times a doctor might say, okay, well, I'm going to give you a back brace, and that's going to help you through your movements, and that's good for the time being. But effectively, what we really want to do is train our body so we don't have to wear that brace. We don't always want to have to put that on over our shirt or things like that. So we want to teach you guys the ways to just keep that stability on your own. And then it also teaches you how to keep your body aware. And then you'll start noticing on your own that you're able to adjust and make those different adjustments that you need to make throughout the day if something doesn't feel right. And then knowing how to use these muscles properly is going to assist you with fluid movement, help with our posture, which a lot of it can be bad habits. And then it's going to assist with your lifts here in the gym and just how you move out in the community. So we're going to go into the assessment. This part right here is going to be very hands-on, and we love using volunteers. So I'll tell you guys in a second when we get to pick my volunteer and it gets exciting, all right? But the first one we're going to do talking about is a postural assessment. So if you were to come into my clinic and I'm your PT, the first thing I do from when you walk to the door and you get on my table is I'm looking how you walk. I'm looking if you have any gait deviations. Do you walk with a little bit of a lean in one spot? The reason is that I'm looking for muscle imbalances. So when I'm doing a postural assessment, that's what I'm doing. I want to see how you sit, how you stand, and how you carry yourself throughout the day. I'm looking at how all of you guys sit right now, and I can already kind of start thinking things in my head, right? So the reason for this is we want to check for spine. We want to see how your spine is moving, if it's moving equally or if I see any aberrant motions or any shaking or things like that. It's also going to give me a good understanding on how your core is working, on how your back's working, hips, legs, and how everything works together. Because you can't talk about the back without the hips. You can't talk about the hips without the back. It all comes together, right? So this is also going to tell me how your flexibility in your hamstrings are, how your flexibility is in your spine. Do people wake up in the morning and they feel stiff as a brick? Anyone or just me? Because I'm starting to feel it too. Okay, awesome. So that's kind of where I'm going to look for those muscle imbalances, because if we don't fix those things, it just kind of makes things more difficult if we continue to work that way, right? All right, so who is going to be my first volunteer? You can just kind of feel what we're going to go through. All right, come on up. What's your name?
Joe.
Joe, nice to meet you. All right, so first thing I'm going to have you do, just stand right here, looking this way. We'll do it together. Okay, so my assessment as a physical therapist is I'm looking right here. You just stand there, Joe. You're doing great. So I'm looking at his shoulders. Are his shoulders rounded forward? Is his chest out too much? Is he hunching over? I'm looking at his hips. Does he have a forward tilt like this? Are his hips more back? I'm also going to go ahead from the back. I'm looking at his knees. I'm looking at how his toes are. Are they inward? Are they outward? Some other things I notice immediately. I'm picking on you kindly, okay? Cool. So Joe's left shoulder is a little bit more forward than his right. Are you right-handed? Okay, so a lot of things that happen here. I'm trained to look at these things. If you guys don't see the little difference, it's okay. Joe's right shoulder is a little bit farther down, right? So when I'm assessing him, the first thing I'm looking at is that means that there's something in his shoulder right here that's pushing that shoulder down. If you're actively using your right hand more than your other, think about your lats, think about your rhomboids, think about all those muscles that we get trained to bring down and back, right?
I don't think anyone here knows where their lats are.
No? Okay.
I'm kidding.
I was like, wow. Okay, sorry. Yes. But, so he's using those muscles all the time, so now I see a little bit of a shoulder drop here, right? So that's normal, though. It's not like it's a crazy thing. It's a red flag. But now that just means that I maybe want to test the strength on the left side because there might be a deficit. So I'm looking at things like that. But Joe looks pretty solid. You look great. You're not done yet, though. Okay, Joe? So since you did so great on that, I do want to explain this is kind of like a motion checkup, okay? So what we're doing here is I'm just looking for different imbalances. Like I said, there's no perfect posture. No one has a perfect posture, but it's just good that if we can see something, why not go ahead and fix it? So I'm going to show you the first one that you're going to do for me. All right, Joe. What you're going to go ahead and do is you're just going to go down, touch your toes, and then come right back up. Good. Touch your toes and then come back up. Good. You're going to do that for me one more time. Good. Do you feel any tightness, Joe?
Yeah.
Do you feel more tightness on your right or your left side? Come on back up. Or do you not have a difference?
They're both the same.
They're both the same. Okay. So here what I'm checking for is, like I said, our spine is a stack of bones, right? I'm trying to see if every vertebrae in the spine is moving together at the right time. If I see one starts to move when it shouldn't, then there might be either a mobility problem here or it could be a stability problem here. Joe's pretty solid. So I want you to go ahead and look towards that wall right here, like turn your whole body. My fault, bad instruction. Turn your body like this with me, Joe. You'll face that way. Good. No, you're fine. Now go ahead and touch your toes again for me. Good. And then come back on up. Little tightness in the hamstrings. Okay, that's okay. You can have a seat for me, Joe. I appreciate it. So that's the first thing we do. It's super simple like that. But that gives me a good idea of where to kind of start with your plan of care. Make sense? All right, and then also we want to think about muscle imbalances that can contribute to pain. And that's what I was telling you guys about. Tight hamstrings, tight low back, that can contribute to a postural habit that we do all the time, the way that we sit. And then down the line, like I said, that can kind of make things more difficult. So when I'm thinking about posture, when I told you guys about that hip lean, when you go forward like this, do a lot of us sit or have had jobs where you're at a desk all day? Yes? No? Okay. So what happens with that? Our hip flexors get tight, these muscles here in the front. When our hip flexors get tight, what happens, it's called a cross syndrome. If hip flexors are tight, low back gets tight, okay? If low back starts to get tight, it's going to pull our pelvis forward, which I was talking about, and this is going to increase that arch in your low back. So you naturally already have that discrepancy right there, and then we ask you guys to do a squat. Your pelvis is already in that position, then you go in a squat. When you get to the end of your squat, you're like, why does that hurt so bad? You're starting to strain ligaments that aren't meant to be strained during that movement, okay? So that's kind of why I'm saying it's really important putting PT and the personal training aspect together. It's really great to be able to kind of look for these deficits and nip them in the butt before it gets too bad. And then another thing we want to think about is weak core glute muscles. So if Joe was standing up here and he was in this position, now I'm looking at him, I'm like, wow, his core is pretty extended. That means that there's probably some weakness there. That muscle's not tight where we want it to be. With a weak core and weak glute muscles, it's going to make my back work overtime to support my body, right? So basically, postural assessment just helps me identify any muscle imbalances and just kind of start with our plan of care so it's not super general because we want it to be super specific to you guys. Now the next thing we're going to do, everyone stand up for me, please. Cool. Great. All right. Now this one's really simple, so we don't need a special volunteer here. You're just going to go back to where you feel comfortable and come back forward. Just extending from the low back. No one feels pinching, right? No pinching, no bad pain, anything like that? No? Okay. Or does anyone? You can, if you want to be honest and explain. A little bit of pinching. Okay. All right. You can go ahead and have a seat, guys. Thanks for standing up for this. But this one right here. So when I have patients come in, when I have clients come in and they say, I need you to work on me. I have herniated all my lumbar disc. Everything. It all went, right? Or my L2 to L3 is gone. My L4 to L5. And they do this pinching they go like this and they get pinching, it's really worried, like they start getting worried about it. What that just might mean is that we have an aggravated nerve there, or that ligament is pushed out a little bit farther than we want, but it's not a situation you have to live with forever, right? That's why I have the spine protocol. It's going to teach you how to use that natural brace and to be able to start to strengthen that area around it so we don't have to immediately go to surgery. That's not our first option we have to get, right? We can try to be conservative with it at first. And then now the next one that we're going to go ahead and talk about is a deep squat, okay? So this one will be fun. I'm going to have everyone do this one first. So go ahead and grab your bands, but I'll show you first, okay, guys? So we're going to be right here, holding up your bands like this, okay? I'll show you first and you guys can do it. And then when you're here, I want you to go ahead and squat and come back on up. So everyone go ahead and show me how that looks. The goal is to keep your arms right at your ears. Good. Just like that, arms straight. Good. Very good. All right, everyone, go ahead and down. Good, and come back up. Do it for me 3 times because we just need to warm it up a little bit. Good. Awesome. Okay, does anyone have discomfort doing that movement? Anything feel a little odd? No? Who wants to come up? With no one that has problems, it's fine. You can just come up. Anybody?
I'll come up.
Okay, you come up. Great. What's your name?
She doesn't know anything?
Yeah. What was your name?
Cindy.
Cindy. All right, Cindy. I'm going to have you do it with this for me. I know you guys have the bands, but y'all can have a seat. So good. It's going to be arms right here, right to your ears. Good. Feet are shoulder width apart. Great. Now go ahead and go into a squat for me. Good. That's nearly perfect. You said Cindy? Okay, awesome. One more time for me, Cindy. Good. Now come on back up. All right, last time. I just have to look. One more time, sorry. Good. Now you can come back on up. You don't have to stand up here while I discuss it, but I appreciate it. So the reason I have her do it 3 different times. This movement right here is great because it's going to check your full body mobility, okay? So right here, I'm looking for a good squat. It's going to have your ankles are going to be able to move properly so your knees can go forward because we need that to happen, right? So we can get low enough. Also, your hips. If you have the ability to be able to sit back properly. Also, you holding your arms up like this, that's a lot of extension that we want you to have in your spine. And we want you to be able to have the strong enough core muscles to keep that extension up here. What I noticed with a lot of you guys, Cindy, you crushed it. That was amazing. But what I noticed with a lot of people, what we automatically start to do, and I'm going to show you because I just have to kind of explain what it looks like, is we start to lean forward, right? And everyone could kind of feel that. So when we start to lean forward, what does that mean? It could either be the extension in your back. You don't have enough extension, so you have to start leaning forward because you can't maintain that. It could also be shoulder mobility. If this rod starts to go forward, you might not have the shoulder mobility that you need to keep it down here by the ears. Make sense? Now also hip mobility. If I'm looking at your hips and you can't sit and sink into the hips enough, now I can go ahead and assess the joint. Is it your hip joint that's limited, or is it the muscles surrounding your hip joint that's limited? And that's the good thing about physical therapy is that in my assessment, I can get super specific on what's the problem, because the assessment here is a nice one specifically just for back. But if it were a hip problem, I would have a whole nother protocol to kind of go through as well, right? And then ankles. If you're down here and your hips are going down great, but your knees are doing all this, now I'm starting to look at the ankles. Maybe there's a mobility deficit in the ankles. And again, I'm going to go ahead and assess the joint. A lot of that is manual techniques, and I can get a good idea of what that's looking like, okay? Does anyone have questions on those? Yeah. I'm so glad you asked that. Okay, we're going to keep doing that. Great. So that right there. Who cares what it's called, but it's called genuvalgum. It doesn't matter. It's not even when I said it. But anyways, genuvalgum, your knees go in. What that's going to tell me right there is we need to really work on knee stability, or I need to look at what muscles are causing those knees to go in. So giving an example, as women, a lot of times our adductors and these inside muscles are more strong and they get more tight. So they're going to pull in the knees like this. What I would want to work on with you, I would then see how you do it single leg, then compare it to the other leg. If I notice it like that, then my mind immediately says, I need to do something where we're going to start working on strengthening all these outside muscles that can assist in keeping the knees out and not letting them cave in. And then I'm going to assess your hip range of motion. Maybe you have too much rotation one way more than the other. So like I said, it's like a very general way to then start to find the more specifics of what's going on, okay? Any other questions? No? All right, so let's see the next one we're going to go ahead and get into. So this one right here, yeah, the deep squat, it's definitely going to be our movement x-ray. That's what I like to think of it as. It's going to tell me which muscles are weak or tight, and then it's going to help me understand, is your core supporting your body correctly, right? And it's also really good to see what is your confidence like and how coordinated are you throughout these movements. So this is a tool that's definitely going to help me target your treatment by choosing exercises that are specific to your issues, because not everyone's body is the same. So now we're going to go into the next one. It's our active straight leg raise. So everyone lay on a mat for me, please, if we can get on a mat. You good there, Park?
Yes. Sorry.
All right, everyone's comfortable? Good. So now, Parker will be my demo. Can everyone kind of see? Sorry, bad time to make everyone lay down. Sit up again. We're testing your core. Everyone sit up again. Awesome. So you're going to be laying back like this. Parker, you lay like that for me, please. So now what I want him to do is an active straight leg raise. He's going to keep this leg down. I'm going to ask him, arms to your side, please, and down. I'm going to ask him to raise this leg right up here. Good. And then bring it back down. Keep your head down, though, for me, okay? Up again. Good. Bring it down. Now I want you to lift the other one. Lift it up. Good. And then back down. Do you have any discomfort in your back or anything like that? No. Good. I'm going to ask him to do it one more time for me. Go ahead. Lift. Good. Something that I'm looking for right here. Is there an arch in his low back? Is there something that's pulling his hips forward, right? So I want all you guys to do it, and I'm going to kind of come around and feel and see if everyone's doing it right. You can call me over if you want me to check specifically. Good. Very good. So go ahead. Yeah, legs straight, lift. Awesome. And then back down. And then lift the other leg. Good. Does anyone feel any discomfort doing this? You feel discomfort. What do you kind of feel here?
Feels like when I do that, my back lifts right there.
Your back lifts right here, right? Yeah. So guys, his back feels like it's arching a little bit. So I want you guys, we're going to go ahead and teach you while you're in this position. You guys have learned what a posterior pelvic tilt is, right? We've all learned what that is. So what I want you guys to do for your posterior pelvic tilt, just kind of listen to my instructions and hopefully it makes sense, okay? So while you're laying there, I'm going to take a very big, deep breath in, but breathe in through your stomach. I want your stomach to be going up, not your chest. All right? Good. It looks like everyone's done it. Great. Now I want you to breathe all your air out and try to make less space in the arch of your back. Close in that space. Good. Just like that. Do that again. Breathe in big. Fill the stomach. Breathe all your air out. While you're breathing out your air, close that space that you feel behind your low back. Now, holding that position, try the straight leg raise. Good. Now what I want you guys to do is hands on your abdomens. And now feel your hip bones in the front. Go up a little bit from your hip bones, so up towards the midline a little bit. Good. Now I want you guys, up more towards your head. Right there, yep. Like this. This is the area we're looking for, okay? Good. Go ahead, do that big breath in again. And then breath out. When you breathe out, close that space in your back. Good. Now I want you to cough. Do you feel that area in your fingertips? Do you feel a contraction on those muscles? Okay, not a lot?
Too much fat.
No, that's not true. Right here, hold right there, good. So that right there, maintaining that position right there, guys, you should be able to breathe normally and talk to the person next to you. So tell me your name.
Tim.
Jim or Tim?
Tim, yeah.
Tim, okay, so you're holding this position great. I feel the space in your low back has stopped a little bit. It's way less. Are you breathing normally?
Yes.
What are your plans today, Tim? Can you talk to me while you're holding this position?
Yeah, I can talk to you.
It's a little hard, or is it easy?
No, it's not really hard.
Okay, good.
No plans, really.
No plans, really. Okay, so Tim's able to hold a conversation with me while he's maintaining that. When I go to the gym, I'll literally start with just this little exercise, right? It's not that much, but it's really being able to control your pelvis and your low back and having it in the position that you want it. So does anyone else feeling discomfort with this one?
I heard someone say they felt clicking.
Clicking, okay. Clicking in the hip?
The back.
In the back. Okay, I'm coming right on over there. So go ahead, Tim, raise your leg again for me right here while you close this space. Does that feel any different for you? Up again, down, and up, down.
Well, like you tell, my back is flatter.
Back is more flat. Okay, good. So that I want you to think about that anytime you do these core activation exercises we're going to do. Okay? All right. Where do we feel clicking in the back? Cheryl. Hi, Cheryl. Hi. Y'all can sit up if you want for a second or keep doing it. Up to you guys. But all right. So I'm going to teach you that movement again. I want hands right here. Good. Breathe in. Fill in the stomach. Good. Now when you breathe out, close that space right there. Good. Keep doing that. And now lift that leg for me. Good. And then down. Good. And then down. Where do you feel clicking? Left or right side?
On the right.
On the right
Not
side.
doing it
Not doing it
unless I
anymore?
Raise my leg higher.
Okay. So right here, we're in this range?
okay.
Okay, good. And then go up further where you feel the clicking.
I didn't do it.
Okay, good. So that's just a simple, right, it's not one thing fixes everything, right? But that just shows when you start turning on those right muscles, It's creating more of a stable core set naturally with the muscles. Make sense? Yeah. All right, everyone, let me see what the next thing is before I tell you to get up from your mats. All right. Anyone have any other questions on that movement? No? Okay. Our next one, this one's fun. Okay. Yeah, let's go ahead and get into this one. Bird dogs. I know everyone knows what a bird dog is here, right? All right, great. So we are on the mats. This is great. I'll just explain a little bit what the bird dog is. So the reason this one's important is that this is going to test how good our core muscles around our spine and our hips can work together to control movement, right? So I want you to think of it as how your body stays stable when your arms and legs are moving in opposite directions. So everyone go ahead in your bird dog position. You can nap over there. Everyone get in your bird dog spot. Yep. Yeah. Good. And then keep alternating for me, right? Then go into the other side. Good. Because there's a physical therapist staring at them. All right, good. So, very good. So what are some cues you guys are given when you do bird dogs that come right to mind on how we need to be?
Back level and still.
Back level and still. Good. What was yours?
Well, yeah, the hip from
Keep
coming up.
keep the hip from coming up. Great. What are some other ones?
I tell people I'm going to balance my favorite glass of wine on their back.
Yes, I like that one. I'm going to start using that one. Anyone else have some other ideas? Keep your what? Pocket down. Yes, exactly. All right. If it's uncomfortable, guys, y'all can get out of the position. But okay, so things I'm looking for. That was great. Don't open up the hip. Keep your pockets down. That one's good. Keep your low back nice and flat. So while you're doing the bird dog, I want you guys to maintain that posterior pelvic tilt that we just thought about, okay? So go ahead and try for me one more time, only if you guys want. If you're tired of it, it's okay too. Go for it. Yeah. Great. You saw that correction you made right in the beginning? That's amazing. Your body becomes aware of it so quick. Good. Go for it. Awesome. Very great. Holding it up at the top for 2 seconds is ideal. And then you come back down. Good.
And what should they be feeling when they're holding it?
When they're holding it, you should feel your low back muscles really doing work to keep this up. Keep the leg up and keep the arm up, okay? Oop, I'm so sorry. Yeah. And your belly, yeah. So that core, the posterior pelvic tilt I just showed you, that activates your core muscles. So if you can feel that right there, Cheryl, you made that correction right away. That was good. Cheryl's that way. Good. All right, guys, y'all can go ahead and come back to our seats.
Didn't know you were coming for a workout, did you?
I suspected it.
And like I said, these are things in my assessment when I'm seeing someone. These are things I'm looking for, because if I do see that hip open up, there might be a deficit on the right side. The bird dog is actually super important training the multipidus muscle. That muscle that was right in that middle picture, that muscle attaches to every vertebrae in your spine. If your lats are great, you have such a pretty back, I can see all those muscles, but your multifidus isn't working well, you can still get hurt very easily. Makes sense? So those are the muscles that are really important to train because they're attached to the spine. They protect the ligaments and they protect any of those other things that can happen with a quick injury, okay? So also what I want you guys to think about why a bird dog is important is that many functional activities that we do require our trunk to stay stable while our arms and our legs are moving. For example, when you're running, your trunk is pretty stable for the most part. We're not like running like this, right? Trunk's pretty stable, but my arms and my legs are moving. If I don't have a stable trunk, I'll probably start to get some low back pain when I run, because if I don't have this in the middle controlled, doesn't matter what's happening all around here, it probably won't feel so great. And then another example, carrying our groceries from the ground, picking up our kids, picking up our grandkids, whatever it is, that I need my trunk to be stable while I start to try and transfer energy from my upper extremities or from my legs. Make sense? Now we'll go into the next one, guys. Thanks for being so cooperative during the assessment. That was great. We're going to go into mobility training. This is also all, the rest of this is going to be hands-on, okay, guys? So lumbar trunk rotations. I'm going to go through showing you guys the movements first, and then we'll kind of split up however we need to so everyone has enough space, okay? Do you want to be my person to show them? Okay, great. So a lumbar trunk rotation right here. Heather, you'll lay on the ground for me, please. On your back, thank you. So what I want to do, to make sure that there's enough mobility coming from her back, I want her hips to be locked. So what that means is she's going to be in this position like this. It's also kind of like your book openers that you guys do, okay? Both arms straight that way for me, please. Good, now open up, keeping this straight, and all this, only this will move. So open up and follow through with your head. Good, just like that, and then back down. Good, and then like that, and then back down. Good. So you're gonna do 10 of these on each side. This is great mobility for you to do at home. If you wake up in the morning, you feel stiffness, go ahead and do this one right away. You can even do it while you're in your bed. There's no excuse to not do this one, okay? And then you would go ahead and go on the other side. So that's the first one. Like I said, we're gonna go through all of them. I'm just gonna show you them first. The next one is our half kneeling thoracic rotations. This is now thinking about upper back. So not so much low back. This is our people that have some pinching in the middle of their back, pinching in the middle of their scaps, and they don't know where it's coming from. It could be a mobility issue, so we would address it right here. So Heather, you're gonna be right here. One knee's against the wall. This knee's gonna be up. Left knee's up, right side's against the wall, great. It's like you've done these before, awesome. Now go ahead, arms straight. Okay, I'll get out of y'all's way. Arms straight right here. Heather's gonna open up and rotate, follow through like that. Go as far as she can, good, come back. Now what I wanna look for is, I don't want any movement in the pelvis here, right? Good, and then back down. And again. Do you feel a stretch more in your upper back here or in your lower back? More there on the side. Well, we have QL stuff. I've been working with Heather. I know why that's working. But anyways, on you guys, I want you to feel a stretch more in the upper back, okay? So that first one we did is more lower back. This one's gonna be more upper back. Now we'll go into the next one. 90-90 rows. So this is gonna be great for hip mobility. So we'll go over here, tie this. You guys are just gonna tie this right here around the post. I'll come around and help y'all if you need. And go ahead, you're gonna do a 90-90 for me. Good, and now what you're gonna do is make sure there's enough tension when you lean forward. I want it to be a hip hinge movement. Good, and now pull back and row. Great, again, pull back and row. Where do you feel a stretch here?
I have my hips.
In your hips, where on your hips?
Right where your hand is.
Right out here. Okay, so my hand is right here on her glute med. These are external rotators in our hips. A lot of us have it very tight because we just don't know to stretch them, right? So this right here is gonna give you a great stretch around the hip muscles. So the first one we did, low back. Second one we did, upper back. And now this is the pelvis region. Next one, Heather, you sit right there, great. Seated good mornings. So you're gonna have your band. You're gonna be in this tall sit position. If this is uncomfortable, I can modify it for you, okay? And you're just gonna hinge at the hips again. Hinge forward, good, and then pull back up, but nothing at the arms, just like that, good. Pull forward. This is stretching our deep muscles down here in the back that I was telling you guys earlier, and then she activates them right away to come back on forward, okay? It's really good to train our muscles to be able to move from a very stretched out position and then activate them right away. An example of that is your RDL. You lengthen that hamstring all the way, and then immediately you need to contract it to get right back on up, right? So this is a great way to prep the body for those movements. Make sense?
In this one, you're doing the rest of the neutral spine.
Keeping a neutral spine, yes. And keeping that posterior pelvic tilt. And everything else I kind of mentioned earlier, okay? So let's go ahead and do those. We have some set stations.
Yes,
Yeah.
I think the best option here is if you want to do the first one, which is the on the floor like this.
Yeah.
Go ahead and get to that right now. If you're open to starting with the band or the
rotation one right here, yeah.
Go ahead and head that direction, and we'll do our best just to like balance out it as we go. I'm gonna have you two move off the wall so we can use these racks to try that. The idea would be if you're on the bands, just try both the exercises. Maybe 10 reps of all both sides of the row, and then the hamstring 10, right? And then we'll move on, move to the next station. Same with the half kneel, maybe 10 on each. If you're on your mat, 10 on each. Does that make sense?
Yeah, and we're walking around.
Nice chaos.
Yes, break. Good.
If it hurts, that's when you should say something.
What? Yes, if something hurts, now's your time to ask me. If something doesn't feel right, now's your time to ask me.
Just go anywhere.
Anywhere, yeah.
Okay, let's go.
So I'll kind of help you out. Yeah. Does that bother your knees right there?
You know, my knees are good. It's my
Okay, all right.
and my
Yeah, so here's your foam roll. It's no, I'll show you, other leg.
wrong one.
Yeah, it's okay.
Thank you.
Sonia, can I use that ball or are you about to use it? Thank you. All right, right here. Good. So I want you to squeeze right here.
Okay.
Just hold that position and both arms are straight ahead, like that. Now I want you to open up this arm.
I think the shoulder hurts.
Hurts too much? Okay,
Yeah,
and
it's
then fall.
under care.
Okay, no problem. No problem. I'll have to ask you more about that, okay? But is it too bothersome to go like that right now?
No,
No?
I'm sorry. I just don't want to hit you.
Oh, no, you're okay.
I can't go far back.
Then that's
Like
okay. Just stop where you can,
Like
okay?
2 weeks ago, I couldn't even lift it.
Well, this is great.
It's really doing well.
This is good. So when you do that, though, I want you to see how his head's following it?
I'm going like this.
Yeah, and sit up straight. There we go. And make sure your hands, your eyes follow your eyes.
I know what you're doing.
I don't know.
Good, Aaron.
Doing perfectly.
How do you feel here, Aaron? Do you feel a stretch in the upper back?
Then
Okay.
we switch.
Right into that area.
Right in that area, like kind of behind the shoulder? Okay, gotcha.
Then I
And then you would switch over. See what it feels like on the other side, yep.
Thank you. The other side should be better.
Good. Very good. Do you ever feel like shoulder mobility problems or anything like that?
Little.
A little bit.
Stiff.
It's stiff, right.
It's stiff. It's
Okay.
stiff today, I can tell.
I got you. Well, there. That's good that we have this one now. I mean, right here, kind of holding your hips so they don't move, okay? Ready? Go ahead. Open up. Good. Feel that in the low back a little bit? Or where do we feel this?
Let's see, where do this? I feel it here.
Kind of here and here, right? So that's all the way going up your spine. So it's a great exercise for you to do. It goes really top to bottom, making sure that all the joints are moving properly. Yeah, and you got to breathe through them. That's the hardest part. Good. Very good. You feeling okay?
I am.
Great. We need to move this chair for you a little bit so you have some more room. All right, so I'm going to show you that one. What was your name? Beth. I'm going to show you a little tweak on this one, okay? Yep. So the way, show me your position you were in. So the best way for you to feel a stretch here is use that other arm. So if left leg's in front, I want you to use right arm. Now lean into it. Good. And then back up. Do you feel a different stretch when you do the other arm? And then up. Good. Do you feel a stretch in the hips at all? Yeah, exactly. So this is a good one, super tight. This is a good one, like obviously you want all of them to be something comfortable that you can breathe in. You don't want to be going to a range where it's super uncomfortable. But if you start doing this more often, I mean, you'll start feeling a difference. Okay. And the good thing is with mobility and stretching, obviously it's not, oh, I did it once a week. It is something that I recommend like 3 times a week is pretty effective. Makes sense? Yeah. Okay. But that's great. You should kind of be feeling it out here on the hips. Yes, yeah. That's exactly right. Very good. Very good. Awesome. Good. All right, guys, how are we doing over here? We're not forgetting about y'all over here. Yeah. Very good. So right there, so don't bend. Keep it straight. Lean forward. Yeah, of course. And now when you come back up, row. Good. Lean forward. And now when you come back up, row. Do we feel a stretch in the hips here in the 90-90? Because if we don't, I can adjust it.
I feel it more on this
On this side, that's
yeah.
okay, yeah, good. And I want you actually to be, try to hold your band out here. Can you go back more? So you have more tension? Good. And I'm gonna show you what 90-90 really is. I want this leg to be straight. Can we get that there? Like that, yeah. And now hold up the spine. Good, now lean forward. Feel, that's okay if there's some, and then now row and pull. Good. You're right, it does need some tension. Hold on to it right here. Right there, good. Okay, now lean forward. Good, and up. Good. Arm straight, lean forward, and then row. Good. Feel that really on the left side, and now on the right, yeah. So whenever you guys are in your 90-90 positions, try to really make sure that this one, that's so it's literally 90, 90, 90, 90. Make sense? It's not easy. Oh, let me get you in a better spot. Thanks for printing out the stuff. I appreciate it. All right, let me help you out here. All right. How do we feel holding this position? It's a little tight.
Yeah. A little
yeah. Go ahead and come this way so you have more space.
Okay. Right there?
Yeah. Okay. So ideally, I want this hip to be this knee to be right there. Good. All right, and I need you farther away from the post, so you might have to completely move around. But like farther back. Back here, back here. What's your name?
Mike.
Mike. That's my dad's name, I won't forget. All right, Mike. Even farther back. Sorry, I'm picky.
No, you're good.
Do other hand.
Right.
Other hand. Okay, good. Now try to hold yourself up straight. Is that hard?
No.
Okay, good. Now go ahead and lean forward. But I want the arm straight when you lean forward. This arm. So lean forward with arms straight. So that's how I want you back more so you have more tension on the band.
To there?
Or just there, yeah. Now come back up. Good. And now forward. And now come back up. Do we feel any tightness here at all, Mike?
No, not too bad.
Not too bad?
Yeah,
Okay,
I can
good.
feel my hip on the right.
A little bit of hip on the right, right. So this is just an easy way to really start to do some mobility in the hips, whether it's in the morning or before a workout. But ideally, this is what I want it to look like, Mike. Ready?
Okay.
You'd be out here. Here, let it go for me.
Sure.
You'd have more space, so you'd be out here,
Okay.
holding it,
Right.
and then there'd always be tension on the band.
I
Does
got
that
it.
make sense?
It does.
But I know we're a little bit less
Here,
of
so we're
space
just
right
doing
here.
it shorter here.
Yeah,
Just
just
for
doing
tight.
it. Yeah, of course, of course. But that makes sense. Yeah, good. And if you don't have a band at home, you really just hold this position. Yeah, so we'd be here. Sorry, I'm all in y'all's space. You just be here, and I use this. So if my right foot's in the front, my left arm's the one moving, I just go like this and then back up. Yeah, so you don't need the band really, okay? Oh, yeah. Yep. Yeah, good. Very good, guys. Any questions?
Really quick,
Yeah.
the other one that you had. I
Of
wasn't
course.
feeling-
Oh, the seated good mornings? Let me see it for
I
you.
only feel it in my hands.
Well, that's a really good spot for you to feel it. Yes, yes, yeah.
Because I wasn't feeling anything
Yeah,
in my back.
no, it's okay. That could just also mean that you don't really have problem in the back, right? So you're gonna lean forward, good. And now think about squeezing these muscles, come back on up. Good, just like that. Now lean forward, good, and come back on up. Feeling the hams? Yeah, hamstrings are gonna be something that's a little bit limited sometimes, so that looks great. It also makes you really think about starting to fire the glutes when you're in that position too. So once you're in that position, when you're all the way down here, think about kind of squeezing the glutes like you do before in RDL and getting them up, okay? Very good. Any other questions, guys? No? All right, awesome. Doing okay, Tim? Tim, right?
Yes, Tim.
Tim, okay.
I'm kind of limited because I
Knee
knee
problems.
replacements.
On the right. Both of them. When was that?
I did both in 2024.
2024?
Yeah.
Oh, that was recently.
It takes
Okay.
9 months to a year. And
Okay.
I'm past that point.
Okay.
But, yeah, it's just
We'll keep working on it.
one thing I noticed I had a question on is
Yeah.
in my back.
Yeah. Yeah. Bigger than the other side. Yes, that's something that I do see pretty often. So obviously I don't want to give you anything without really assessing you full all the way, but that means that on the right side something's not firing the way I want it to, and it's working overtime using these outside muscles. But there's muscles that are way deeper than this outside one that aren't working properly, okay? But that's just with education on how to fix it, those things can get kind of worked on.
Okay.
Yeah. So if that's something that you want to do a full kind of look at how everything is, I mean, I could definitely do that for you too.
What they told me a few months ago was now that my knees are okay,
Yeah.
that my back is a
Starting
problem.
to compensate
And I
a
got
little bit.
Compression in 2 and 3,
Okay.
and then 4 and 5.
Okay.
And there's been some leakage.
Oh man,
but I
okay.
can still,
You can still move around,
yeah.
and you're here working out, so you
But
can
I-
still
but
do
I-
it.
But I feel stiffer.
Okay, I gotcha.
And then every morning, I wake up, after training, like we trained yesterday.
Yeah.
We do Wednesday and Friday. My whole back across here is just stiff.
Yeah,
And then once I'm up and moving and around,
you feel
it
better.
gets much better.
Yeah.
But that may just be something I can't fix.
No, I think it is fixable. We just got to do mobility work. So like I said, whether it's something where I check you out, see how everything's moving, and I can give you some mobility stuff to work on. And I also have some manual things that I do too, okay? We can chat about it more at the end though if you want to, okay? Sounds good? Has everyone been able to go through them, or where do we at? You been able to do them all? Joe, right? Joe. Joe, okay, I need to get my names down. Good.
In that one, like how she looks really
Good.
good to me. Like if your legs turned out like this,
Yeah, that's okay. That's okay. Feel okay?
Yeah, my back hurts though.
Back hurts? Do you feel tightness there?
Tightness.
Yeah, so here you see how rounded you are. Try to straighten that up for me. Now maintain that when you go down. Is that hard to hold? Yeah, so it's just lack of like extension in this part of your back, which I've got plenty of things kind of, it's more one-on-one I'd be able to kind of talk to you about. But yeah, that's where that's coming from, is it's hard for you to stand completely straight up here. So you're starting to compensate in your, low back. Makes sense? Yeah. That looks good though. Hamstrings, do they feel okay?
Yeah, those are fine.
Okay, that's awesome. See, my hamstrings feel crazy when I do that. All right, well, I'll be here. That's the cool thing now.
Chronic situation where every morning when I get up,
Right here in the low back.
right, not well, it's
More in the glute area.
the top,
Yeah.
it's like stiff as a board.
Stiff as a board. We'll have to chat after this,
I
Joe.
just have to sit for 30 minutes.
That's not right.
And then
Yeah.
I get up and do my stretches.
Yeah.
But I haven't done some of these. So I'll
Okay,
change
good. Yeah, we'll chat more after for
Takes
sure.
like 3 hours before you get really moving.
Yeah, right. And we don't want that. We'll definitely have a chat after. Alrighty, everyone. How we doing?
Tim, just gonna try this one.
Yeah.
We can listen.
Okay, we're gonna go into, I know I wanna respect everyone's time. So I'm gonna show you a couple of the activation exercises I do, and then we're all done, okay? This is our last thing. So to be better with our time here, I'm gonna go ahead and show you guys them. I'm just gonna show them myself, if that's okay. That's just kind of how I like to move with this. And then if you guys wanna stand up and see me do it, that's totally fine. But everyone has their band, right? Yep. All right, y'all can stand up and watch me do it. I'm gonna be down here. So we all know what a glute bridge is, right? So first thing you're gonna do is you're gonna have your hands a little bit past the ears, like shoulder width, okay? You're gonna hold the band like this. You're gonna open the bridge, like this. This is not gonna keep you kind of standing. Before you get into that glute bridge, think about your posterior pelvic tilt. You're pressing that space behind your back. You're going into the bridge, and marching. Here it is. Marching. Slowly over here. Okay? So let's go ahead and try that one first. Good. There we go. I knew I'd love this place. This is awesome. Here's your band, sir. Huh?
Do you want to switch or do you want that one?
Blue one or purple? There we go. I'll move stuff around. The band doesn't matter about tension. It's just to give you a cue of holding up like that, okay? So arms are going to be right above your chest, so not too far back right here. Ready? Good. There. Good. Slow and control. Good. Keeping that posterior pelvic tilt. Great. I feel that working right there. Now go down for me. Again, breathe in through the stomach. So take a deep breath in, fill the stomach. Good. Blow out, close the space behind your back. Go into your bridge. Keep breathing for me. Knee march. Good. How does that feel? Good. Looks solid. Very good. How are we feeling here?
Good.
Not great. What do you feel here when you try to go in the bridge?
Pain in my back.
When you try to go into the bridge?
Yeah.
Okay, when you go into extension. Have you had any problem before with low back pain?
I have spinal stenosis.
Spinal stenosis.
Arthritis. I have a peripheral nerve stimulator.
Down there. Okay. How do you feel doing the posterior pelvic tilt? Does it feel comfortable, like a position you can get into?
Yeah, it actually feels good.
It feels good, right? Alleviates a little pressure on the back. So instead of doing the march, what I want you to do is just go into a bridge right before you feel pain. Is that right there okay?
Yeah.
And then down. What I would do with you is I would start in this range. Just teaching your pelvis how to do the movement, then we add all the leg things. The leg stuff doesn't really matter. That's more towards the end we can get to it. But just this right here, 3 sets of 10, you start doing this movement, okay? That's solid.
Very good. Thank you.
Yeah. How are we doing over here, guys? Sorry, I haven't given love to this side of the room. Go ahead, do that tilt for me. Posterior pelvic tilt, solid. We hold that. Now march. March up, good, and down. Good, how does that feel? Solid? Looks solid, your core is tight, pelvis isn't moving at all. Any questions? All right, that looks great. What was your name?
Kevon.
Kevon?
Yeah.
Nice to meet you. How's this one feeling? We okay? Do arms back a little bit, right there, yep. Keeping that good, very good.
Does anyone else want assistance? It feels like I have a question about this one.
These look good, guys. We're all warmed up now, this is great. All right, next one. Next one, dead bugs. Everyone knows dead bugs. Let's get into your dead bugs. What are we gonna do before we get into our dead bug? Nice, wow, that was great. Posterior pelvic tilt. All right, so get into the starting position of the dead bugs. No movement yet.
We do have, Mike is not a client, so he might need more.
All right.
In case he doesn't know what that means.
Well, Mike, we got it, Mike.
You just showed it? Okay.
Oh, perfect. There we go. We got good teachers here. Awesome. Everyone hold it. Do you guys feel a space behind your low back? Does anyone feel an arch back there? Wow. So we're doing, yeah, we're doing it great. Okay, we're doing it great. Knees at 90 degrees. Keep holding it. This is part of it. Keep holding it. Good. All right, now show me opposite leg, opposite arm. Good. Opposite leg, opposite arm. Yeah. Ready, Tim? I got you. Tim, hold your dead bug first for me. Hold your dead bug. Ready? Up. Arm straight. Yes. Pinch that. Great. When this arm goes back, this leg goes down. Ready? Go for it. Yes. And then back up. Again. Yes. And then back up. Feel okay there?
Yeah.
Good. It's a hardcore exercise, but you're doing good, Tim.
That was easy as you think.
Yeah, no, it's coordination too.
Let's see here, straight.
So I want you to start here, like this. Good. Now go for it.
Karen, no one said rest.
Yeah, no one said rest. There we go. Good. If the coordination part is too much, you just go ahead and do one side at a time, okay? There. Good.
Okay.
Yeah.
Yes, sir, go.
So this one, when I pull back here,
Tightness in the shoulder. Yeah.
slowly you're gonna get this arm.
I mean, I can check out your shoulder for sure. I will definitely look at
In
you.
the idea of this exercise, you do what you feel capable of and don't go further. Yeah. Two questions.
Yeah.
I see a lot of people's lower leg that is like compressed like this. Does that matter?
Lower leg?
Like their knee, their calf is hitting their hamstring when they're doing it versus like, see how?
Oh, yeah.
Like,
No, yes. You want it 90 here. We want it here. 90 degrees.
None of that. None of that.
It's good.
Question number two.
Question number two.
What are they supposed to be feeling, and what are the muscles that they're really?
Okay, we're feeling our core. It's all core, deep core stability. You good? You feel your quads? I feel my quads too. That means you got some nice quad dominant legs. I've got that problem too. It's okay to feel it there. And last movement, guys. We ready? All right, this one we're all standing up really. So So this one, get your bands wherever, or you can do it with a partner. So I'll show you how to do it with the band. Band is going to be here. Okay, this is the real question. Is it Pallof or Pallof? That's the press.
He's not, the guy that invented it is not American, so I guarantee it's not pronounced the way we think.
Okay, that's fine. So however you want to pronounce it, we're going to go ahead and be like here. This is our Pallof presses. That's how I call them, so we're just going to do it like that. I want your hands to be right in front of your belly button. From here, you're going to press out and then come back in. This is working on that multipidus muscle, deep muscles in our back, okay? If that's too easy, we're progressing it. Your progression is going to be out, up, controlling that, come back down, and back in, okay? If you don't have a post, I'll just hold the band for you, or you can do it with a partner and they'll hold the band for you, okay? So I have a band right here set up for anyone. We have another pole over here. Y'all go ahead and start and I can look at it. So hold it like this. Yeah, just like that. This band might be too light for you. I know. Oh, okay, I got you. Let me get you a harder band. So you're here. Press, start here. Press out, up, all the way up. See how it kind of pulled you? You're going to maintain this straight. Yeah, back down. Hold the band like this for me. Oh, they can't hear me. Good. Up. Good. Do you feel the right side of your back working more or the left side when you're here? Lefty right here?
Yeah.
Okay, good. And back. Press out. Forward. Nice. Still need a thicker band, right?
Yeah.
So ideally, you do it with a thicker band so that you feel it. Good. All right, you've done these before. How do they feel? Do you feel your back working to keep the band straight?
Yes.
Okay, good. I feel it right here working too. You're using the right muscles. That's good. Let me see who's doing it. Good. That's too tight. Here, give me 1 second. Yeah, I'll hold it for you guys. Ready? I'm your band. Okay, go ahead. There. Up. There and back. You see how it's pulling you? Yeah, you're going to use that left side of your back to keep that straight. Very solid. Feel okay? And you see how you get a little rotation in the hip? That's what we're working on, anti-rotation. We don't want it to move, right? Good. Feel okay, guys? Awesome. Yeah, of course. Good. Straight arm, nice. And then what I want you to think about whenever you're doing banded work like this, the band, the pull should be straight before you do anything here. Ready? So there, now push. Push out, good. Arms straight. So push out, arms straight above the head. Keeping that straight, nice, then down. And then pull back in, yep.
All the way down?
Yeah, just like that. How you just did it, go up. Good, back down, bring to the middle. Feel okay?
Okay, yep.
Very good, awesome. Push on out, arms straight, good. Does that feel okay?
Yeah.
Do you feel your muscles working right here?
I do.
But you're more shoulder.
I'm shoulder.
Okay.
Tight.
Okay.
Yeah.
Shoulder mobility's
Shoulder and
been
hip tight.
shoulder and hip tightness. Okay. Have you been checked for shoulder mobility or hip mobility, stuff like that? Does it bother you with overhead lifts? Anything like that? Sometimes yeah.
It's just even more hanging.
Hanging.
stuff.
Okay.
Yeah.
Okay. Yeah. That's definitely something we could
It's
look
better.
into more with time.
I've had not locked shoulders.
Yeah.
But like shoulders where even doing something like this.
Your
is
external
really
rotation is
painful.
different than, yeah. Okay, makes sense.
Yeah.
Definitely could check kind of your range of motion, see how everything moving.
Yeah.
Whenever we set all that stuff up, give you guys time to see me or however you want to go about it, and I can kind of assess that for you, okay? Yeah. All right, guys, everyone's doing awesome. Any questions? That's all the exercises and the presentation.
I have multiple clients that go to him.
All right. Thank you guys so much. This is the spine protocol that you guys all get to take home with you. It's in the presentation. So, like I said, these right here are a great thing to add to your routine that you already do. You guys already care about having a healthy, active lifestyle. You guys care about having good movement. So this is just another tool to add, okay? And then obviously you guys will have my information too now. I did put my email on the first slide. We can go ahead and maybe set up an assessment if anyone needs it. Yeah, Heather can go ahead and.
So I think Joel just asked me, like, is she working for you? What's going on? She's going to work here. So basically, the really great thing that's happening is she can do an evaluation on you in the gym. You can book the session through me, through the app that we already use. She can kind of see what's going on. You guys can talk about a protocol, and you can book evaluation sessions. You can book actual rehab sessions with her, but then she's also communicating with the rest of us. Hey, this client really needs to be doing these exercises in their protocol moving forward. So when the coaches are building your programming, those exercises can stay in them long term based on her recommendations. Or we can now go to her and say, I'm having this issue with Travis and I really want to let you look at him and help me address it so that we're moving forward in the right direction. So that's why we think this is like a very exciting, progressive thing for the facility, and giving you guys all that opportunity to utilize her, because she's very smart and very fresh out of school, so she's got all the...
So I'm excited. It's a good thing. I'm excited.
And she's excited, but...
Yes.
Yeah, I've worked with a lot of physical therapists, and she's my favorite so far.
Thank you.
So what I will do is I will send an email kind of introducing her to the facility, and I will put a booking tab in there for you guys to book with her. She's going to start just booking certain Saturdays, but it's kind of like a test run, right? Like, let's see how much people want to utilize her, and of course they're going to want to utilize her, so we'll end up adding time slots for that. Does that make sense? Sound
Yeah.
good?
I have a question though. Let's say that we're training on certain days. Should we set up when we're training here to? She's only gonna do it on Saturday.
Yeah, so we're only doing
Saturday
Saturday right now, but that's something we're going to work out as we go, Tim, for sure. Those are good questions. And then I think, anything else, Roger, am I missing?
Any question on the presentation?
Well, that's where I was going now. Yes, the floor is open to questions, or you can stay after if you prefer to have a private question.
They're also patient.
But thank you all for coming. Any questions?
Thank you guys. Appreciate y'all. Awesome.
Tootsie just wakes up.
Tootsie, you're so sweet.